Welcome back to another episode of ICU. Today we are going to be talking about tools for symptom management, tools for your pelvic floor. And to talk about this with me, I brought Rachel Peck. She is a pelvic floor physical therapist. So welcome to ICU, Rachel.
Hi, thanks so much for having me. I'm excited.
I'm excited too. So a little backstory for people. You and I got connected on TikTok. I think I was just scrolling one day and your video came up for me and I was like, oh, cool, a pelvic floor PT. Like I will always automatically follow anybody in your field. And I started watching your videos and they're just like really easy to follow. I feel like you're doing a really good job of educating the masses and just talking about a variety of different topics. So you're doing amazing,
Thank
sweetie.
you.
Sorry, I had to say it.
I appreciate that. Thank you so much. Sometimes it feels,
So
I'm sure you know how it feels like with social media. Sometimes it feels like you're throwing things out into the void and you're like, I have no idea who even sees this or appreciates this. So thank you.
exactly. So that's how we met. But do you want to just give your brief introduction so everyone can get to know you better?
Sure. Yeah. So, like she said, I'm Rachel Peck. I am a pelvic health physical therapist. I currently work in Gainesville, Florida, at just a very small little, like, outpatient orthopedic private clinic. I do a combination of pelvic health and orthopedic, so a little bit of both, but pelvic health is definitely my passion, my baby. And yeah, I see a variety of types of issues and types of patients, but I really just enjoy what I do. I do some social media videos just to get information out there, as well as a way for me to learn myself. I started doing that kind of when I first started doing pelvic health, and it's been helpful for me to have to like fact check myself in a lot of ways.
Yeah, for sure. Where is Gainesville in Florida?
It is in the middle of Florida, pretty much as far from a beach as you can get in Florida.
Is it near Orlando at all?
It's about 2 hours north of Orlando. Um,
Okay.
so it's about 2 hours from everything. 2 hours from Orlando, 2 hours from Tampa, 2 hours from a beach on one side, 2 hours from a beach on the other side. It's kind of it's where University of Florida is. So Gators, I guess.
All right. Sweet.
um, yeah, yeah, it's the swamp part.
The swamp part. I actually just watched a movie last night with my boyfriend. It was like a scary movie or thriller about there was this like this is so off topic, but it was like a group of college kids that were going somewhere and their private plane crashed and next thing you know the alligators are on meth and they're just going crazy and it was not the greatest movie, but it just made me think of that.
Yeah, I mean, meth and gators. That's Gainesville in a nutshell.
It's like the movie Cocaine Bear. It's just like so crazy, but like you could kind of see it happening.
Yeah. I've seen enough alligators.
Yeah. Oh my God. Anywho, back on topic. You and I were kind of brainstorming like what is a good topic that we could discuss that would help people that we haven't already talked about on this podcast. So we landed on the topic of tools for symptom management. So I think we're going to be talking about tools like the pelvic wand, the dilator, TENS unit, cupping, things like that. So that's what we're about to get into. But I feel like the easiest place for us to start is probably with the pelvic wand and dilator. So, would you be able to kind of give us a brief overview of what each tool is and what the purpose of using it is?
Yeah, absolutely. So I wanted to sort of start out this discussion by saying that unfortunately, there is very little research when it comes to a lot of these tools, like specifically and especially for things like interstitial cystitis, painful bladder syndrome. There's like some research for some of the tools for a couple of different things. Like, for example, dilators have good research for some sexual dysfunction. TENS has pretty good research for just general, low back pain, things like that. But just as I'm sure you have seen with a lot of different things, there's just very little research in general around IC, painful bladder syndrome. So this is no exception to that. There's just not research. And that doesn't necessarily mean these don't work. It just means we haven't done the studies. So we sort of pull what we can from what we know about using these things in other situations, and we see what works for different people. And everybody's going to, use each tool slightly differently. Everybody's going to respond a little differently to each tool. So it's a matter of sort of trying different things. But I sort of will pull up research where I know it exists, but unfortunately there just isn't very much of it. So I want to, use that as a little bit of a caveat as we get into it. It's frustrating, but it's the way it is right now. But yeah, sort of starting with like the pelvic wand. So a pelvic wand is essentially a tool that looks kind of like a little seahorse. It's a little bit curvy. And the idea is to use it to be able to get to places in the pelvic floor that you can't really get to with your own hands. When you go to pelvic PT, for a lot of people, the pelvic physical therapist may be doing some sort of myofascial release, some sort of soft tissue work, some sort of quote unquote trigger point release to the pelvic floor muscles. Many people with interstitial cystitis, painful bladder syndrome, or other chronic pain, pelvic pain issues have a lot of tenderness and discomfort and sensitivity in their pelvic floor muscles. And the pelvic wand can be a tool that's used to work on those muscles independently. It's kind of like if you've seen those Theracanes for your back. I'll tell people like those little self-massage tools for your back. It's that, but for your pelvic floor. It just allows you to get at those areas a little bit more easily. I think the biggest thing with tools like this is it allows some sort of independent treatment. It allows the patient to be able to do something for themselves, to take control of some of their symptoms, maybe manage a flare, which can be really invaluable for someone who deals with a lot of flare-ups or who deals with a lot of chronic pain, to be able to have something they can do themselves and utilize a tool themselves in order to manage that.
No, I totally agree with you on that. Like on a personal note, I feel like it's really empowering to have tools and to be able to do things yourself. Um, Also, like a lot of pelvic PTs are hard to get into. You can't, or maybe there's like your insurance won't cover it um, every week or something like that. And I feel like this is something where you can do it on your own. You can do it yourself as long as you need your own pressure. I personally love my pelvic wand and I still use it to this day. But when I was like going through the worst of my bladder pain, that was probably the most helpful thing for me, considering I had a tight pelvic floor my whole life and nobody ever figured that out. So that's my little spiel about the pelvic wand.
Yeah, absolutely. Exactly right. Like, I think there are patients who come into me and they're like, look, I need some relief, but I'm not going to be able to come really regularly. I want to be able to do as much as I can on my own at home. It's so nice to be able to have some of these tools to say, here's something that you can do, especially if you find that you get some sort of relief when we do myofascial work, when we do quote unquote trigger point release to the pelvic floor muscles. You find that helpful, let's find a way that you can do that independently. You're not having to come in, every week or multiple times a week in order to have that done externally. So I think pelvic wand is great for those people who have that tension in the pelvic floor and are able to work those certain points out themselves. So I do like the pelvic wand for that. And I do feel like a lot of people with interstitial cystitis, painful bladder syndrome can benefit from that type of work. Now, there's also things like dilators. So again, I have a couple of examples, but dilators are these little cylindrical objects, usually made of some type of silicone or plastic, that go from usually a very small size to a much larger size. And the goal with these is to sort of move up on being able to insert sizes from a small size to a big size. I would say that the dilators are much more commonly used for sexual dysfunction. So things like vaginismus, vestibulodynia, things where people are having a hard time inserting things, whether that's sexually or a tampon or a speculum. And a lot of that can have to do with, of course, nervous system activity, heightened nervous system, a lot of, fear avoidance around that, and then also tight pelvic floor muscles. So being able to work in a very gradual and slow way on inserting something a little bit bigger and a little bit bigger can be a great way to retrain the system, retrain the brain, as well as the pelvic floor muscles to relax and allow for that to happen without kind of going into panic mode. So, sometimes people ask, like, well, when should I use a pelvic wand and when should I use dilators? They can both be really helpful for slightly different things. Some people do use both, but I would say if you have to sort of choose one, usually I would say a pelvic wand is more for those people who don't have as much of an issue necessarily with like inserting things or can tolerate it to an extent, but have more of these like specific site specific tender points in their pelvic floor. And they can sort of work in those areas, versus I think the dilators are going to be more for a general global kind of pelvic floor relaxation, brain retraining. It's all brain retraining as well, but kind of that global relaxation of the pelvic floor and working on that specific goal of being able to tolerate larger and larger sizes. So, and I know that there's a lot of overlap between people who do have IC, painful bladder, and people who have sexual dysfunction. There's a lot of crossover there. The Venn diagram is is tight. So I think those dilators, I often use dilators with patients who have IC as well as vaginismus, vestibulodynia, etc.
Yeah, there's a lot of overlap. Like I used both at certain points on my journey, and back in my late teens, early 20s, like I was dealing with a very tight pelvic floor and also like the vulvodynia, vestibulodynia. So they started me out with dilators. And first of all, being like a newly like 18-year-old young adult, to be handed like a dilator, I was like, what? You want me to do what with that? It was such
super scary.
Oh my God, it was such a shock. But yeah, like luckily I was on my mom's insurance at that time and they like covered the cost of the dilators for me. I was like, this is pretty lit. Thank you for that. And so that experience was pretty interesting. I mean, I don't really remember using it. I feel like I probably could have used it more, but funny side story, I was just cleaning my room out at my parents' house because it was a disaster and I had so much stuff there. But my mom was helping me and I guess I hid my dilator in one of my drawers there and she found it and was like, what is this? And I was just like, oh my God, Mom, like, you're probably not gonna believe me, but it's a tool for my pelvic floor. And she's like, yeah, okay. I'm like, Mom,
Sure,
this is
sure.
this is so weird for me. Yeah.
I know a lot of people ask if it like gets shipped in like discreet packaging because it's unfortunately they look like more than just tools.
Right. And like honestly, wasn't Amazon like not letting Amazon was doing something weird with like pelvic
Yeah,
tools, right?
the whole moment there, it was a couple years ago, and I don't remember exactly if it got resolved or if anything changed. I didn't totally follow up with it, but there was a minute there where they were classifying, dilators, pelvic wands, etc., in just like the sex toys category. And, we were all kind of upset about that because it does keep people from getting, the help that they need, especially if that's already a little bit traumatizing or triggering for them.
Yeah.
But I don't know how that ended up, if that changed at all. But yeah, most places that do sell dilators do have very discreet packaging when they send it. And I'll say it's your insurance covered it, because I would say out of all of the tools that we're talking about, dilators are the most expensive.
Yeah, I don't really know why, but they did. I was like, cool. I guess I'll take this.
Yeah, absolutely. I know that for some people, their like health savings account will also cover things like dilators and pelvic wands. So that's something that may be helpful as well.
Yeah, definitely. So when you are I guess I'm curious, like, what is your method of teaching someone, like a patient, how to use a pelvic wand?
So, usually I will, first of all, explain, we're finding these issues with your pelvic floor. You found that when we do some sort of myofascial release or some sort of soft tissue work, you find that to be helpful. There are devices where you can do that independently at home. I'll bring out the pelvic wand. I'll show them what it looks like, kind of basically show how you're supposed to use it. And if they are interested and they end up wanting to get one, I'll send them a link. I'll have them purchase it. And I usually have them bring it into their next session with them. And then, because people, a lot of times they see it, they're like, oh, it seems pretty like self-explanatory. But a lot of people, it's a little bit of a learning curve. Some people struggle with figuring it out at first. So we may go through, here's how to use it, here's how to angle it, here's how to figure out if you're using the right amount of pressure. And then I'll have them do it themselves so that we can make sure everything feels all right. If that's not an option for the patient or they're not going to be able to come back in, there are a couple of instructional videos online that I will send them that kind of go through it. I'd say the biggest mistake people make at first is just pushing too hard with it. You really don't need to push very hard.
I'm going to tell you a little fun fact about me. I broke my first pelvic wand. I don't know if there was a defect in the product or if I was pushing too hard. I feel like I pushed too hard, and yeah, it was not fun, but they sent me a replacement.
That's good. Oh my gosh. Yeah, that would be startling.
They were like, that's never happened before. I was like, oh, that's wonderful to hear that I'm the first.
Great. I really wanted to be that person.
But you're right. Like it's hard to know like what type of pressure to use and all of that. There's a huge learning curve. I remember I had no idea what I was doing. My pelvic PT that like introduced it to me, I didn't get like a hands-on lesson. And I went home and I was just like, I put it in. I'm like, I don't really know what to do here, but I'm going to move it around a little bit. And I feel like for me over time, it was just like trial and error, but it sounds like you're giving your patients like a really good education. And like you said, there are videos out there that are really helpful, but if someone can be taught hands on, I feel like that is the most optimal option.
Yeah, absolutely. I feel like people find that to be helpful. But yeah, at the end of the day, you're right. People will kind of figure it out eventually. I think if we can help smooth out that little hump of the learning curve, that's great. And then also it helps to decrease the amount of times people like try it once or twice, can't figure it out, and then never pick it back up. Right.
Yeah.
So if we can figure it out from the get-go and they can have some improvement with it from the very start, I think that's going to help people feel a lot more confident about it. So I try to be really engaged with it from the beginning.
Yeah. And are you recommending like a certain frequency for people to use it, or does it depend on the person?
Very much depends on the person. I would say if somebody is starting out and they get a lot of help from manual work, they get a lot of relief from it at the beginning, they have pretty high symptoms generally, but they feel some relief when they do it. I would say starting with this like 3 to 5 times a week, kind of a little more regularly, allowing your body to chill in between, but more often in general to give them that relief as much as possible so that their nervous system can calm down. And then as symptoms get managed, you don't have to use it usually as often. I have some patients that have transitioned into only using it during flare-ups. So if they have a flare for some reason, they'll pull it back out, but otherwise they don't really need it anymore.
Yeah, I'm in that category right now. Like I just stopped taking it on vacations with me, like when I travel. And I'm always like giggling when I go through TSA with that. I'm like, oh my God, what did they think that is? No one's ever said anything, so it's
Oh my
fine.
gosh.
But
TSA. I once had a vibrator pulled out by a TSA agent. It was like this young, probably like 19-year-old kid. And he like pulls out this vibrator and is looking at it like confusedly. And I'm like,
oh my
you don't want to touch
gosh,
that. Like, just put it back.
you don't want to know.
Yeah.
Oh my God, that's crazy. But yeah, I mean, I feel like I used to do it daily when things were kind of rough, but then get like with time, my symptoms improved and then I was using it less and less. And yeah, I like rarely use it now, which is really great. I was gonna say when I use it, I would say half the time I use it. I will either be focusing on some deep breathing, which I feel like is probably what you as a pelvic PT want us to do. And the other half of the time I'm scrolling on TikTok. So are you giving people directions for like what to do while they're doing it?
Yeah, yeah, absolutely. I do advocate for a much more like mindfulness based approach, and then especially I would say with the dilators, like a lot of deep breath work, a lot of like mindfulness, really kind of engaging with the tool. I find that a lot of people who have pelvic pain, who have some of these pain conditions, are really very disconnected from their pelvis and their pelvic floor. So they're willing to kind of use the tool, but the first thing they want to do is like mentally dissociate from the process. So, which in some cases, if that's where you're at when you need to start, if that's where you need to start at, like I'm willing to meet you there and then kind of progress from that. But I do try to encourage people to put away the distractions, to kind of engage with it mindfully, put on some music that you like, light a candle if that feels good, make it a nice sensory experience, but make sure you're present. And again, that's not always going to be the case. It's, people are going to be where they're at, and that's okay. I would rather they, still engage with the tool. But yes, definitely the deep breathing, the nervous system management. Sometimes we'll do some like somatic tracking exercises, things like that.
Yeah, I love the whole set the vibe idea, set the mood. I do have some clients who, like, maybe they're a parent or they're like a little bit embarrassed or just like more cautious about using it. And so they'll do it like in the bathroom or in the shower. Like, is that still like a good option for people if they have to do it that way?
Yeah, absolutely. I also, yeah, I tell people that as well. If you like doing baths, do it in the bath. If that's a pleasant place for you to be and a place where you can have some privacy, then, or the shower, that can be a good option as well. Yeah, absolutely.
Okay, I'm getting flashbacks to a bachelorette party I was at in Nashville. I literally used my pelvic wand like in a small closet and I was like squatting down. I was like, this is absolutely horrible. 0 out of 10 experience, would not do it again. But yeah, I feel like everyone has their stories. I'm sure everyone listening who's used the wand probably has a story. So you guys are welcome to reach out to me and share your stories. Maybe we can all have a good laugh together. But
I know. I've had some people try to like figure out how to use dilators while they're like at a family reunion. And I'm
oh
like,
my
at
God.
that point, so I just tell people like, give yourself a pass. It's, it's okay. It's going to be all right to give it a week.
Mm-hmm, definitely. So in terms of like purchasing a wand or a dilator, there's a lot of brands out there. So people have options at different price points. Like, are there any brands you typically gravitate towards?
So there's a few different brands for like pelvic wands. I think one of the more common ones that people know is Intimate Rose. They've been in the game of like making pelvic tools for a while. So they make wands and they make dilators. They make a few other tools as well. There's Soul Source is another brand that makes pelvic wands. I think there are like more and more brands that are starting to make these. Like you mentioned, Desert Harvest is
Yeah,
potentially
they
having
have I have it right here. It's like it's not glass. Maybe it is glass. I don't know.
Yeah.
Glass like. And then, yeah, I have Intimate Rose. I feel like there's another brand that I'm forgetting about.
I
Um,
looked at my notes just barely. New Flora has a pelvic wand. I think I don't know that Soul Source does. I know they have dilators, but New Flora is the one that I was thinking of. They also have a pelvic wand. I believe it's a silicone one. Um, and I think one of the things that it's very like dependent on what the patient sort of gravitates towards. They're all, I would say, fairly similarly priced from this like $30 to $50 range for a pelvic wand. I think the Intimate Rose ones can be nice because they have the two different widths on the end. There's like one that's sort of meant for vaginal use, one that's meant for rectal, but you can use either for either depending on what feels good. There may be some other brands that do that as well, but they have roughly the same shape. It's very much dependent on patient, like what your desire is.
mhm. Do you have a special, or not special, but do you have like a lubricant or lube that you recommend people use when they're doing these things?
I don't have any one specific one. I usually just recommend some type of water-based lubricant. Slippery stuff is what I usually use in the clinic that people don't have issues with generally. So I might recommend like a slippery stuff or a good clean love. I just tell people try not to use like a silicone-based lubricant because it will degrade the tool over time if it's a silicone tool.
Yeah, that makes sense. I just ran out of lube and I was in the grocery store the other day and I was looking at what they had because I was like, oh, I'm in a grocery store. I need this. Let me check it out. They had that Good Clean Love and I wasn't familiar with the brand, so I didn't get it. I actually went to my Instagram stories to ask for recommendations and I was like, oh man, maybe I should have got it. So I'll try that in the future. But for me, like, I really like the slippery stuff was a little too like sticky for me, if
A
you can
little
believe
goofy.
that. Yeah, I personally have been using this brand called Lola, Lola. Um, Gets the job done. And then in the past, I've also used Desert Harvest's Aloe Glide, and I really like that one.
I've heard really good things about the Desert Harvest one, and I haven't heard of Lola, but I'll have to check it out.
Yeah, yeah, they sell like they sell a lot of things. They sell like condoms, they sell, I'm pretty sure they sell sex toys, but they're like more organic, like that type of thing. Um, and I've also used coconut oil in the past. I don't know. What are your thoughts on coconut oil?
Yeah, I would say some people really just prefer the coconut oil or oil based type lubricants. I would say, yeah, that's fine if that's the preference. I think there's, as far as I know, there's nothing wrong with using the oil with the silicone. I believe it's just with condoms that that can be an issue.
The amount of things I stained with coconut oil in my lifetime is super annoying. Like it was just like I would literally buy like a whole jar of it and I would just take it as needed and I wouldn't screw the lid on all the way and then it would just like totally destroy a bag when I'm like traveling. So I discovered Trader Joe's sells like individual packets of coconut oil. I was like, okay, that's a better option. Where was that when I needed it the most?
Yeah, I didn't know that. Yeah, I didn't know they sold that. That's cool.
Hmm.
Yeah,
Okay.
that is the downside, the staining.
Yeah, for sure. Is there anything else worth mentioning on the topic of the pelvic wand or dilator before we move on?
I think that's about everything. I mean, we could talk about, we could talk about dilators forever and ever, but but I think that's yeah, a good place to be.
Okay, cool. So moving on, I think the next tool I'd like to talk about is the TENS unit. So that's another tool that I used. And also my insurance covered, shocker, on my journey. So can you talk about that one?
Yeah, so TENS or transcutaneous electrical oh my gosh, now I
You're
just
on the
totally
spot.
yeah, right.
Is it nerve stimulation?
Yeah, neuromuscular stimulation. Man, now I'm wow, good job, Rachel. Yeah, but the TENS unit, the or E-stim, it's also sometimes called just electrical stimulation, is one of the more researched modalities or devices, I would say, just in general for pain. And there's two different ways I want to talk about it. You can use TENS for just regular old like pain relief, and there's like a couple of different ways that we sort of theorize that it works. We've got like the gate control theory, which is where it sort of floods the somatosensory receptors and the nerves, and because the pain neurons or the pain signals are a little bit slower, they can't really get through. So there's like that whole theory, which is also related to a lot of the ways that just general like myofascial work works, release of endogenous opioids. It's fairly well researched just in general for pain, and we know that it has a positive effect on pain, meaning it helps to decrease pain in general. It has some good studies for low back pain, at least in the short term. It can really reduce pain. Again, very little research when it comes to bladder pain, interstitial cystitis, pelvic pain. But I think we can kind of take some of the studies for other types of pain and uh, sort of extrapolate. We do still need studies, of course, for IC, BPS, chronic pelvic pain, etc. But I think that the TENS can be a great option just from a pain relief standpoint. And for just the general pain management, you can put the electrodes on your abdomen, you can put the electrodes on your low back. A lot of people who have these types of conditions have pain in both of those places. And with specific settings, you let that electrical stimulation kind of do its work, and that can be a really great just like pain modulating tool. Again, can help to calm down the nervous system, just give yourself that little bit of relief. TENS units are, I would say, also fairly cheap now. You can usually get a TENS unit from anywhere from like 30 to 100. There are some that are a lot more expensive, some like really nice ones that are in the, $200, $300, $400 range, but usually you can get totally great TENS machine for $40 that you can adjust the settings. Another thing or another aspect of the TENS that I wanted to talk about was to use it for transcutaneous tibial nerve stimulation. I don't know if you've, looked into that very much. It's mostly been researched for like urgency, more for like overactive bladder types of issues. And it's gotten a good amount of good research for urgency. We know that by stimulating the tibial nerve, which is where you put the pads kind of on the inside of your ankle, we get an inhibitory effect on the bladder. So the bladder stops doing the kind of little spasming that can happen with overactive bladder and urgency. Again, very little research in like interstitial cystitis, bladder pain syndrome. There's a little bit that says it may also be helpful from a pain standpoint. But for some people, that tibial nerve stimulation can really help just calm the bladder down, and can be really helpful. So that's another way that people may not have thought of using it, but that has gotten more research in the last little while, 10 years or so.
Yeah, I'm glad you're mentioning it because we do have OAB people that listen to this podcast. There's people with IC who also have like the urgency and frequency. So that's good for them to know. If somebody wanted to try this, I mean, I know that they can buy it on their own, but like, is this another thing that like a pelvic PT should train you on before using?
So, like, ideally, yes. But it is one of those things that is, again, great for just like independent use. Once you sort of have the settings set correctly and you're able to put them on your own, it's pretty easy, to apply it. And then you just have to turn it up and you leave it there for 20 to 30 minutes. You do that, 3 to 7 days a week. And ideally for 6 to 12 weeks, that's usually where we see the best sort of benefits from the 6 to 12 weeks. Ideally, you have kind of a pelvic therapist talking you through the process, seeing if this would be a good option for you. But at that point, I have a lot of patients who, once they're sort of in the period of their treatment where they're more independently managing things, they've got their pelvic one, they've got their tibial nerve stimulation, they have kind of their process that they go through, and they don't need me as much, which is great.
Yeah, that's the goal, right?
Yeah, exactly. Yeah, independence, get people managing the issues themselves. But at first, I think it's helpful to have pelvic therapists kind of go through the protocols with you and get it all set up.
Yeah, absolutely. I wouldn't even know where to start if I didn't have someone like telling me what to do. And even when they tell me what to do, I then go and try it. And then I have so many questions that I need to have these follow-ups. But it's good to know that like if someone out there maybe can't access a pelvic PT, like you still can do this stuff. It just might take more research.
Absolutely. Yeah. There's definitely going to be stuff online telling you how to set up a TENS unit for it, telling you how to apply the pads, how often to do it. So there are more resources out there for people in this type of thing. It's just a lot of people have no idea it's even a thing. So, but that can be a really helpful thing to use.
Okay, cool. Anything else you want to mention on the TENS unit before we move on?
Just one other thing. I think another area that the TENS has been a little bit more studied in has been like dysmenorrhea or period pain, and again, large amount of overlap with period pain and IC BPS. I think there's often also an endometriosis link in there between the two. But there's definitely a decent amount of research for managing electrical stimulation for period cramps. And one thing I want to mention is that there's a lot of companies that will sell devices for period cramps. It's really just electrical stimulation, but they'll sell these devices for like a crazy amount of money when you can just get a TENS machine for like $40. They'll sell these for like $200. It's the same thing. So if you just get a TENS machine, it's the exact same thing. Use the electrical stimulation for your period cramps. It can be very helpful. You just don't need to buy the specific thing for the period cramps.
Gotcha. Okay, cool. So moving on, want to talk about cupping?
Yeah.
Okay.
Let's talk about cupping. So again, a lot of the like theories around how cupping works, and this is one where we just have like very, very little research on cupping. It's largely been used in acupuncture for, a lot of years, and then has sort of made its way over to physical therapy. There are slight differences in the way that cupping is used between acupuncture and physical therapy, sort of site-specific differences in the way that it's utilized. Regardless, again, there's just not a lot of research on it, but a lot of the theories around it are similar to like TENS acupuncture and some of the other things where we just have, that release of endogenous opioids, gate control theory to reduce the pain signaling, helpful for decreasing hypersensitivity, central sensitization. I think, again, helpful tool for people to like self-manage what they're doing. So there's a couple of different ways you can utilize cups. And I would say, again, cups are fairly inexpensive. You can get a set of like little silicone cups like this for fairly inexpensively on Amazon. I want to say like $20, $30. There are much more expensive cupping sets, of course, that like acupuncturists use, but you don't really need all of the, the vacuum type cup. You can get some silicone cups for pretty inexpensively. I would say the most common use that I use them for, as well as have patients use them for independently for things like IC, BPS, would be like abdominal cupping. So again, there's a lot of abdominal tension that can happen in people with pelvic pain, with IC. There's a lot of just abdominal sensitivity and tenderness that happens. And we also, again, see these links with endometriosis, with vestibulodynia, with vulvodynia, again, a lot of overlap in there. And sometimes just being able to engage with some myofascial work in the abdomen, decreasing some tension, again, doing that like independently in a way that feels good is really helpful and really like, powerful for patients. And it can be just one of the sort of pieces in a toolkit that allows them to self-manage their symptoms. But usually I'll have them do some sort of massage cream, some type of lubricant on their abdomen, and I'll have them get a little bit of the suction and just gently move it around on the abdomen in areas that feel good, maybe doing a little bit of lifting, twisting, rotating, etc. We're not trying to make, the huge bruise marks or anything. We're just trying to get some gentle movement of the skin and the tissue and the fascia in that area that feels really sensitive and scary for people.
Mm-hmm. So what is like moving all of that stuff around? Like, what is it doing?
So again, this is one of those things where we have a little bit of we have some decompression of the tissue. We do know that there's some separation of skin, fascia, underlying tissue that's happening where we are potentially introducing some increased blood flow or potentially helping to kind of move fluid around a little bit. I think a lot of the benefit, again, is mostly happening from like a neuromuscular standpoint. There is going to be, again, some like release of anti-inflammatory, cytokines, et cetera, that is going to be helpful for that. And we do know that there are some like systemic effects that can happen with things like cupping. But again, I think the largest benefit is from this like neuromuscular relaxation, this like nervous system management, engaging with this area in a way that feels safe and calming for the brain and can help relax muscles, again, both locally and systemically.
Okay. Is this a similar mechanism to like skin rolling?
Yeah, absolutely. It's like very, very similar. Skin rolling is just something you kind of do yourself. Again, just kind of picking up that tissue, moving it along a little bit. Again, creating maybe a little bit of separation from the fascia underneath. Yeah, skin rolling's fun. Feels good.
Skin rolling, honestly, like kind of freaks me out. Like just the thought of what's going on in there. I'm like, I don't love this.
That's funny. Maybe it's just me. I like to do it. It feels good to do. So I'm like, this has to feel good. But I think you're right.
Yeah.
There are people who are like, ugh.
Yeah, definitely. I'm glad that you mentioned though that people can do cupping like on their abdomen because I feel like when I think about cupping, I've only ever had it done on my back. So it's like you can't really do that yourself.
Yeah, like it's a little bit trickier to at least do like the glide cupping where you're moving it. You can sometimes do some of the static cupping where you just like set it on and leave it, and that people do still find that helpful. But yeah, abdomen's definitely a much more like uh, available area to be able to do that yourself.
Yeah, you might need to recruit someone if you want to do your back. That's
Yeah.
another good topic. Do you ever encourage someone to get like their partner, their spouse, or someone else like to help them with some of these tools or techniques?
Absolutely. Yeah, absolutely. If they have somebody available that they trust and they want to be a part of the therapy, I absolutely have them incorporate their partner into it. I would say, especially with dilators. And that's, a whole nother conversation of like, sexual dysfunction and having your partner be involved with your therapy. That's like, we could do a whole, podcast episode on just that. But definitely having your partner involved with some of these tools. They can help use the pelvic wand. They can help with the cupping. Yeah, absolutely. I think having somebody else involved in your therapy and in your care can be a great, like, first of all, sense of support, just that feeling of like somebody is here on my side helping me out. And it just gets easier on your hands, right? It's nice to have somebody else do that. So yeah, absolutely. I do encourage that if people have that available to them.
Yeah, I think it brings you closer because it is so intimate and you have to trust each other and I feel like it's a cool like bonding activity that you could do. I
Yeah,
don't know.
totally. I think it helps build communication skills. Again, I think a lot of people who have this pain, again, especially if there's some sort of sexual dysfunction or pain as well, there's, yeah, again, very much like a disconnect. They're afraid of this area and they also have trouble like communicating around this area. So having a partner be involved with some of the tools and the care really kind of forces the patient to engage with communicating around what feels okay, what doesn't, what needs to happen, and makes them sort of take control of their care a little bit more.
Totally. And it probably helps with accountability, like can make sure that they're staying on you about actually doing the stuff that you are training them to do.
Totally. Yes, I have a lot of patients who say that their partners are like, "Okay, we're going to do your pelvic one." Like, "Okay, are we going to do your therapy?" Like, let's get on that. A lot of times they are a great like motivational source.
Yeah. Oh my gosh, I love that. Cool. Anything else on cupping before we move on to the next thing?
I think that's good. Yeah.
Cool. I think the last thing you wanted to talk about was vibration, right?
Yes, yeah. So vibration therapy. And again, same thing with everything else, very little research on it. Again, we know that vibration therapy works very similarly to everything else, just helping to decrease a lot of the like sensitivity that's going on. There's like one study that I found on vibration therapy for vulvar pain, and that's like that's like the only study I've really seen when it comes to like vibration therapy and some type of like sexual pain or dysfunction or anything similar to that. And it is helpful for the vulvar pain. Um, the way that I usually have people utilize vibration therapy, it can be done in multiple different ways. And again, we just don't have the research for it. So there's no like right or wrong necessarily. It's just about what works for people. I largely will use it in terms of vestibulodynia, especially. So when people have a lot of that sensitivity around their vaginal entrance, which is really common with interstitial cystitis, endometriosis, etc. I will have them utilize like a very small vibrator, like a little bullet vibrator. And I will have them use that around that vaginal entrance for a couple of minutes before using the dilators or before getting into sexual activity or potentially before using some of these other tools or just using it independently. When they're in the shower, something that's a little easier to do privately if you're, in the shower alone, etc. just to help desensitize some of those nerves, decrease the irritation in the area. And again, like allow the nervous system to calm down when it's being touched. So I think vibration therapy can be really helpful for that. It often just takes everything and calms it down a little bit before they maybe get into some of their other tool use or homework or sex, right?
Right. What about those vibration plates? Like, are you familiar with those? Like
Yeah,
where you
I know
stand
about.
on it?
Yeah, I know about them. I'll say I have not dug into any of the information around if it's helpful for any type of like pelvic pain or anything like that. Again, I imagine just like generally vibration is kind of calming to the system for some people, so could potentially be helpful. I doubt we have any. I doubt we have any actual data on it. Kind of similar to everything else.
Definitely. I was seeing like a holistic pelvic PT a couple months ago, and they had a vibration plate that they were like, "Oh my God, you should try this." And I stood on it and I was like, "This is super weird. I feel like there's too much vibration happening." And they were like, "Oh yeah, you can just like buy one on your own and like do it at home every day." I was like, I mean, that sounds interesting, but I'm like a type of person that if I'm gonna buy something, like I'm gonna invest in it, I want some research before I
Yeah.
do that.
Yeah, absolutely. If you're gonna buy something like big like that, that's gonna be really expensive. I absolutely agree. Which sort of is like brings me to one of the topics I wanted to discuss with like all of these tools. I think you have to always be a little bit careful because I think, especially with this population, uh, chronic pain, issues that often don't have very good answers, there's this kind of sense that like if I can just find the right tool, I can fix everything, right? Like if I can just find this one thing, or if I can, this didn't really work, so let me switch to this one and surely this will be the answer. Like none of these tools are going to be the fix or the cure all to somebody's issues. Unfortunately, I wish if that were the case, that would be like amazing, right? They can be absolutely super helpful, and they may even be central to somebody's improvement. But in general, you have to make sure that people are aware that these should be a part of a bigger plan, like a bigger therapy plan. And that may also include medications, that may also include, pelvic PT, that may also include mental health counseling, etc. But they shouldn't be used just as one thing in order to try to find like the fix, because it's rarely going to work like that. And there's not going to be one that is going to be the fix for one person, unfortunately. So
Totally. That was literally my mindset between ages 18 to 25. I was like, I'm going to find the thing out there that is going to solve everything for me. And I did so many different treatments. I even had like a vestibulectomy because I was so desperate. And when it didn't work, I like crumbled. I was like, that was my last resort. I don't know what to do now. So now that I have relief and I can reflect back on that journey, it's like I totally understand that that you will do anything to get relief, and like you really want that like quick fix or that one thing, but realistically like it's not going to be just one thing or just one tool that changes everything for you. Like for me, for example, the pelvic wand, really great. But that in combination with addressing my mental health and therapy and learning how to breathe. I didn't take a deep breath until I was like 29. Like it was a combination of a lot of different things. So I'm really glad that you brought that up.
Yeah, absolutely. So important. Yeah, I try to like really, if I see that mindset in some of my patients, I really try to like nip that in the bud quick. Because yeah, it can be so tempting to want to really latch on to like this tool, this is going to be the thing that fixes all of my problems. Or being careful with patients who they want to get that one tool, and then they're like, okay, I don't need therapy anymore, I don't need PT anymore, which, while I absolutely do want to move people towards independence, I think that can sometimes be a recipe for a couple weeks down the line being like, this isn't working, or it's not working the way that I wanted it to. So yeah, pelvic PT didn't work for me, this tool didn't work for me, when you didn't give either of them like a good chance.
Yeah. I can only imagine how hearing like pelvic PT didn't work for me probably feels.
It's yeah, it can be a little bit like, and to be fair, like I know I have a bias, I'm aware of that, and pelvic PT doesn't work for everybody, and I am absolutely aware of that. It's not going to be the fix for everybody, and I'm fine with that. But it is when people maybe try pelvic PT once or twice, even 3 visits, and they don't see improvements in a week or two, and then they're like, "I tried it, didn't work for me." I'm like, "That's unfortunately not how it works."
Yeah, it takes time, it takes consistency. Like with all these tools, I'm sure you really have to work on being consistent and it's not going to be a quick fix. Like it took me a couple months to get relief after using a pelvic wand and I had to commit to doing it almost every day for like 1 to 2 months. Like that was I don't know, an agreement I made with myself because I struggle with commitment. So that ended up being really successful for me. But it really just, all of these things are going to be tools in your toolbox that you can use. And some things might work, some things might not work. But, there is stuff out there that you can try. And another thing I just wanted to say before we wrap this up is I know my audience and I know that some people are going to be like, okay, you just talked about all of these different tools. I want to buy all of them and try them all at once. Don't do that. Right, Rachel? Why don't you talk about
Yeah.
it?
Yeah, totally. I know. I have also had those patients who are like, yeah, I'll just get everything. I'll try it all. Like, let's slow down a little bit. Let's find one that we feel really good about. And yeah, like you just said, consistency is huge. Like just being consistent with one thing is half the battle, I think, and like building up an ability to kind of manage your own therapy and all of that. So I think, yeah, absolutely. Most of the time when people do that, when they buy everything at once, they end up not really using anything. So, yes, absolutely backing it off. And then if down the road we're seeing like, okay, it may also be beneficial to add this in once we have gotten really consistent with this. This has been helpful, but we're looking for also some other improvement in a different area. Let's go ahead and add some abdominal cupping in. Let's go ahead and add dilators in. But yeah, exactly. It's I think that just leads to usually not doing anything. If you try to do everything, you won't end up doing anything. So find one and focus on being consistent with that.
Mm-hmm. Love that. Okay, cool. Any last minute thoughts or advice or suggestions for people listening about anything that we talked about?
Yeah, no, again, I think just to kind of recap, the biggest thing that tools are going to be helpful for, it's not necessarily about the tool itself. It's about building up an ability to manage your own therapy, to manage your own symptoms, to sort of develop a sense of kind of ownership over the issue. And managing your own nervous system. So I think viewing the tools in that sense rather than this is going to fix me kind of a mindset is going to be a lot more helpful. And again, ideally engaging with physical therapy at the same time with that tool, being consistent, all of that. And yeah, other than that, it's about building up that toolbox that you have available to you.
Love that. I'm gonna drop links to your socials and your website and everything, but do you want to tell everyone where they can find you if they want to follow you on social media?
Yeah, absolutely. So I'm both on Instagram and TikTok at Dr. Peck Pelvic PT, DrPeckPelvicPT. I was like, did I spell that right? At Dr. Peck Pelvic PT is both my Instagram and my TikTok.
All right, awesome. And are you taking new patients in Gainesville?
Yes, I am. So you can find my clinic at www.gwpfit.com. The company is GWP Physical Therapy, Gainesville Wellness and Performance. And yes, I am taking new patients. And we also just hired a new pelvic PT as well, and she's amazing. So we are absolutely really expanding our pelvic practice.
Awesome. Cool. We will drop all those links and just want to say thank you, Rachel, for coming on and sharing your expertise with us. This has been fun.
Oh, thank you so much for having me. It was great. Yeah, I enjoyed it.